Welcome back to Why We Nurse. I'm your host, Serena Tobar, and today we're tackling a big question. What is the current state of nursing and where are we heading? From staffing shortages and burnout to technology and leadership, nursing is at a crossroads. Joining me today is Diane Flood, a nurse, a leader, and an advocate with a wealth of experience. We'll explore the challenges, the opportunities, and what the future looks like for our profession. Diane, welcome to Why We Nurse. Tell us a little about your journey, what roles you've held, and what keeps you passionate about nursing today.
So I have been a nurse for 50 plus years, and I started young, fresh out of high school. And school was not easy for me. I have had some struggles with how I process information. And one of the great things that my mother did for me was she put me in a 3-year school, which, as we know, do not exist anymore. But the focus of the 3-year program was clinical rather than academia. And obviously, academia was a part of it. But I would not have made it through nursing school had it not been for my experience, clinical experience, hands on with patients from the first month of school. Going through rotations, when we reached the ICU rotation within the first 4 hours, I knew that that's where I was going to be. And I took off running. I worked in the unit for a year and a half before I ever graduated. I worked as a student nurse, and those nurses loved teaching me and learning hands-on procedures. So as I was getting proficient with so many of those procedures, I began to ask myself, well, wait a minute, what is it that I'm doing here? What is this? Because you can obviously teach somebody these things. So what is the distinction of nursing that makes it a really special thing, a calling, if you will? And what I discovered for myself, never told this, but that nursing was not only a science, but it was an art. It is an art. And the science you can teach, the art, you either have it or you don't. And maybe you can have some seeds planted, but you've either got it or you don't. It's like playing a piano. My mother was driven for me to play the piano. I didn't have the skill or the heart for it, so I bombed out there. But I knew when I realized that I had the heart, and that's what led me through my entire career of nursing. I had a couple of patients who will always be in my memory who had diseases that were complicated and family dynamics that were complicated and things that nurses that I saw interact didn't have the patience or even the time to take to unravel some of that to be able to really move it forward. And from a couple of those very early experiences, I was totally validated that what I thought was actually the way that it could be.
I had a leader tell me that one time in an interview, and they said pretty much the exact words you just said. You can teach anybody a skill. I can teach anybody a skill, but it's that heart, that passion, that compassion that you can't teach. You can't teach that.
Mhm. Yeah.
So, how has your perspective on nursing evolved over the years?
I would say in the first 10 years of nursing, even though I had the heart for it and the passion for it, when I was at work, I was 110%. But there was a part of me that was almost embarrassed to be a nurse because I was living in the hippie era and that was not a cool thing. It was way more cool to be out at parties. Had not found the pride. I'd found the pride for myself, but not for the profession. And after many, many years. I actually dropped out of nursing for 7 or 8 years. And then I had an experience in a restaurant where a man was choking and someone knew I was a nurse. And I saved this man's life essentially by doing the Heimlich. And it was the thing that made me realize that's where I need to be. That's where I can make the biggest difference. And that's always where I've come from in doing the jobs.
I like your story about that because not everybody has one of those stories. But I think earlier you mentioned you had some patients that stay with you. And I think those are the stories that everybody kind of has, that all nurses have
Mhm.
a patient, at least one patient that has stuck with them over
I
the
have
years.
so many and so many stories about them.
So let's dig into the hard truth. Nursing is facing some serious challenges. From your perspective, what are the biggest issues right now?
I think the biggest issue is lack of appreciation and commendation to nurses. And, I will always say we don't do what we do for that, but when we never get it, we don't want to do it anymore. And unless we're having a very personal experience with a patient or a patient's family, those attaboys are not going to come at us. I happen to work with a company right now where they are all about that. And they make it so easy to say no that it's very easy to say yes, rather than the yes coming from a place of guilt or shame or burden or pressure. And I think it's the thing that has made the biggest difference outside of me creating my own satisfaction, but to really feel appreciated by the people I'm working for. That makes me want to do even better than I already know that I'm doing.
Yeah, it does make a big difference because I working for an organization that is very much kind of like yours, where they are very much about appreciation and kind of giving you that like, hey, we recognize that you did a good job. And hey, we see you and we appreciate you. And it's not necessarily always, money
Right.
or what is the word I'm looking for? Like things. It's not things, right?
Yeah.
Commercial things, but it's the appreciation, the leadership saying I see you, and just like you said, not guilting you, not think about your coworkers, oh please be a team player and all of those things, because I think nursing has heard that so much over the years that we're kind of sick of, why do I always have to be the team player and somebody else doesn't?
Hmm.
And or why do we always have to be the team players, but the organization is not putting in the effort as well?
Hmm.
And I think that's a big thing, and I think that's playing into some of the challenges that nursing has right now, because nurses are kind of saying that's it. During COVID it was nurses are heroes, nurses are heroes, nurses are heroes, and now it's, well,
Now
this is
they're
what
not even professionals.
right, we're not professionals, this is what you signed up to do. And so we really have to find that balance, between yes, we signed up for a job that was more than just clocking in and out every day, but we also, again, have to put bread on our table. We also have to have our own work life balance. We can't pour
Hmm.
from those empty cups.
Hmm. So that strikes something else for me that I learned in the years of doing hospice, and that is understanding who your team is, as a full team, but who the individuals are and how that team is going to work together, with me sort of out there as the foreman of the group, utilizing each person on that team and then being able to give them exactly what I said a minute ago, the acknowledgement and the attaboys that they deserve for doing that with a heart.
Yes, yes. And I think that's where we kind of fall a little short, is we put people in leadership positions, and I'm not saying that everybody in a leadership position is a bad leader or that everybody in a leadership position is undeserving, but we don't take the time to develop our leaders. So
Mhm.
we put people because they're a good clinician or because they show up to work on time all the time. They have good charting. And so we say, all right, you're going to be a good leader. So we give you this manager role, and they don't know how to lead people. They
Mhm.
don't know how to give the attaboys. Not everybody knows how to do that
Yeah.
in an effective
Without it
way.
sounding sort of condescending
Right, because
or patronizing.
we all have our own, like there's the love languages, right? Everybody has their own love language. We all have our own appreciation language, and we don't
Yeah.
always speak the same appreciation language. So as a leader, you have to learn everybody's appreciation language.
Mhm. Yeah.
So how do you think staffing shortages are impacting patient care and nurse well-being?
I think it is impacting greatly in taking away some of the opportunity for recognition. Therefore, nurses don't want to do more and feel like they're getting nothing back. I mean, it obviously increases burnout and decreases motivation because the nurse, again, if she doesn't have a team and feels the burden of total patient care, and there's a balance with that because one of the biggest complaints I get from patients about being in the hospital is that nobody knows what's going on because everybody's job is so specialized. I only do your vital signs. I only do your wound care. I only give medications. And nobody has a good picture. And there's the concept of team that's not being used. And I think that nurses want to be leaders, even if it's with their 1 or 10 patients, they still want to be able to guide that team in a way that's going to benefit the patient. The team goes away feeling like, yeah, well, I just did another whatever, but there's not the cohesiveness of the team that gives everybody a sense of winning when there's a good outcome.
Right. It's so siloed. Everything is so siloed, and we have
Yes.
to get away. And we talk about multidisciplinary, but until we truly start talking to each other and really being that team, we're going to continue to be in those silos.
Yeah. And I think that concept is, in my experience anyway, easier when you're doing care that's not hospital based, whether it's home care or hospice care or even facility care. I think can do a better job with that if there is enough staff. And if there's not, then that burden's going to either fall on somebody who doesn't want it or it's not going to get delivered.
Mhm. So you mentioned burnout. What role do you think burnout plays in retention, and what do you think organizations can do differently?
You couldn't pay me enough money to go back into a hospital. That's how burned out I got because of all the things that were lacking at the time. I think having more leadership in general terms, but true hands on leadership as well, to know when I bring my experience to you and share it that you have a better idea of what I'm talking about. And without any of that, I mean, it's being so preoccupied with just getting it done that the opportunity for satisfaction is diminished greatly. And you're not going to find it the next place. I've done that. I've job hopped so much and it's just going to be, same song, second verse.
Right. And I think that's what a lot of nurses now in this time in this current climate, a lot of nurses are kind of doing that. They're job hopping, they're agency hopping because they're not satisfied. They're not getting what they need. And again, we don't all speak that same appreciation language.
Mhm.
And so for some people it is like, hey, I need a couple extra dollars on my paycheck. For some people it's, a handwritten note goes a long way. For some people it's the pat on the back and like, hey, you did a great job. So we have to really look at being able to meet our team's needs while also working within the confines of our organization as
Yeah.
leaders, which can be very, very, very fine line to walk.
Yes. Yes.
Do you think the public truly understands what nurses are facing today?
I think they do to an extent because I think in the shape that this country is in right now, everybody is struggling. I've gotten to where if I have to have some kind of service on my home, I look at the cost as that was just 12 hours of my work to pay for the hour and a half of time that this person just spent with me. And I don't think that people who are working for large companies in a lot of areas get that because they're working for the company. If they're working for themselves, I think there's more of an appreciation of what it actually costs to get something done. So I do think the people that have the most appreciation are people who have either been a patient and been fairly ill or had someone who was very ill to recognize the role of the nurse in their care and recognizing that the nurse is the one who is there through the shift, not the doctor. And doctors obviously have their role, and thank God we have them, but they're not the ones delivering the care. And once you've had that hands-on experience with a nurse, if she's a good nurse, then they have more empathy and they have more compassion for the nurse trying to deliver good care.
So, technology is changing our healthcare scene very fast. How do you see innovations like telehealth, AI, and electronic health records impacting nursing practice?
Wow, this is a great question because I can see both sides of this so easily. And on what I would call the con side, there's the connection. It allows me to possibly spend more time with my patient. If there's an algorithm that this AI is going to use to figure out what's wrong with my patient, but it takes a part for me away that I love to discover given time and space. If there's not time, it's nice to have that extra input. And I think, as even told by one of my doctors, they're using AI and they're finding more issues with patients that could have slipped by had they not had that. On the other side, if you've got somebody else's brain, the AI brain, then that might allow for more direct patient contact. And once the information is there, to be able to more easily be shared with the patient.
Okay, I can see that. I can see both sides.
Yeah.
So, do you think those tools are adding to the workload or helping reduce the workload?
Not directly having a lot of experience with that kind of thing in the particular job that I'm doing right now. But what I can say is that I can see it adding more documentation time unless something can just be moved from this file over to the chart. But if I have to spend 15 or 20 more minutes, editing or doing whatever to get this piece of information available or accessible, then yeah, that's going to break down time for me.
So what skills do you think nurses are going to need in the future
Mm.
to thrive with this technology?
The skills that I don't have, which is technology. Technology, I am a complete and authentic technophobe. And the last two jobs I've taken because they're on paper. And if I get set up with a computer, I'm already freaked out. And so I'm 2 steps below or behind. And I'm at an age where I'm going to retire fairly soon. I don't know exactly when, but if I had to look forward to that, I would be out of the game. So I'm glad that I'm at the stage where I am because it overwhelms me and does not give me a sense of joy and ease. I'd rather spend more time with paper than less time with the frustration that I get with technology. And I think that's the biggest thing. And hopefully, with the nurses who are young. I mean, they've grown up with that. They know how to do that. They have that language in their brain. And, they're ahead of the game in that regard.
Yes. My biggest worry with the younger generation as they're coming up and we're getting the youngers and the youngers and the newers and the newers is their ability to interact with people because they spend so much time interacting with technology. I feel like they're going to be great with technology. We are starting to lose the ability to talk to each other person to person.
Absolutely. Absolutely. And that leads me to a story that I'll tell because it's a great story. So, with one of the hospice agencies I worked with for about 5 years, we used to always have a good old IDT every Thursday morning. And our medical director would lead the meeting, and he was a great teacher. And we all had a good 10 minutes to talk about our patient, present their case, talk about dynamics or other issues that might be going on. And for some reason, I always had great stories to tell about my patients. And after a meeting one day, this younger nurse, probably 20 years at least younger than me, came up to me and said, "How come you always get the good patients?" And I looked at her and I said, "You're asking the wrong question." And she had no clue what I was talking about. And so she walked away, and about half an hour she came back to me and she said, "I got it. How do you do that? How do you do what you do to get the great stories?" And I said, "It's all about being willing to not know. It's being willing to be uncomfortable and to be present and be willing to be present, especially in times of discomfort where you don't know the answer." And, a year and a half later, she came back to me and thanked me again for that lesson, because that's exactly what you're talking about, being able to take the time and be willing to connect where that patient is, not where I need to be 10 minutes from now or what I need to put in my notes or whatever. It's being able to stop and say, "Time out, what's going on?" And one of the thrills for me is to wait for that little door of opportunity to open and then kick it in and go, "Okay, I have permission now, and I can go in with this patient and start really digging into what some of the real issues are." And that for me has been the joy of nursing. That's
Yeah.
the art, and that's what I love.
Yes, I love that story because if you think about having been a patient in the hospital myself or, just having been working in a hospital for so long, you see nurses and they have their little computers on wheels and they take them in the room. And it's like, take your eyes off the computer and look at your patient
Mhm.
for just a minute, for just a minute and get that connection because we're just and then we're like, let me see your armband, and we're scanning the armband,
Right.
and then we just hand them a couple pills, and we may or may not even look at them the whole time we're in the room. And it's
Yeah,
like we have got to stop doing that. We've
yeah.
got to push that little cart to the side for a minute and look at our patient. Look at them.
It's a disservice to everyone. It's a disservice to myself, and it's a disservice to who I'm supposedly here to serve.
Right. So looking ahead, what excites you most about the future of nursing?
The possibility of what we just talked about. As things continue to break down, and they will, in my opinion, nurses are going to finally hit the wall and have to, in some way, just like in a bad marriage, step back and go, "The line has been crossed, and you've crossed it one too many times." And then back off to find what my barriers are and what my self care is to be able to take care of myself, put my air mask on first before helping the person next to me. So to have that possibility out there with people who are more in my age or your age to somehow, uh, again, we can't teach that by to teach through example. and demonstration of that because it will be noticed. I've seen it over and over and over where a nurse or a family says, how did you do that? And that example is what can teach better than any book.
Yes, we got to use what we've had and bring in what we're going to have and bridge it together.
Mhm,
I think like you said, sometimes you have to tear something down to rebuild it even better.
mhm,
And I think nurses are they're tired of basically being told you have to be a martyr.
mhm.
You have to give up everything. You have to give up your whole life because you're a nurse now. So everything has to be a nurse, and you have to work every shift, and you have to be happy about it. And you have to give and give and give and give and give everything to be a nurse. Nurses don't want to do that anymore.
No.
They're tired of that.
Yeah.
And so how can we tear that down to rebuild with the technology and with the compassion and like you said, getting people my age and your age together with this younger generation, and we can show them the art of nursing, and they can bring in that technology and that science, and we
Yes.
can marry them together and have a great profession.
Yeah. And I think as far as education, that is the place to start, not jumping into a book and really spending a lot of time, not a day seminar in the first week of nursing school, but spending the real time to hear experiences and to delve into the fears and the anxieties and the question of really, why are you here? And how committed are you? Are you committed if this happens? And if you're not, that's fine. Go find something else to do or find another piece of nursing that might fit better. There's no shame in saying, no, this is not for me. But
Right.
until the recognition comes from the person who's burned out or suffering with their job, until that recognition comes where they have a choice to either walk away or find a different way of fulfilling that commitment that they professed.
Yes. Well, you're absolutely right, because there's so many areas of nursing that you can work in, and we have to remember that no, we don't have to give our life away, but at the same time, if you're working in a hospital and there is an emergency and it's all hands on deck, we signed up for that. That's part of working in a hospital, right?
Yes.
And if that's not what you want to do, if you don't want to have to be there when there's a hurricane, and you don't want to have to be there when there is a, mass casualty event, and you don't want to have to be a part of that, then you go work in another area of nursing. But it's give and take.
Right.
So that other area may not pay as much, but that's what you're saying. I don't want to have to be there for
Yes.
this, so I'm going to do this instead.
Yep. Yep. Absolutely.
So, if you could give one piece of advice to new nurses entering the profession today, what would it be?
Um, I would say probably find a great mentor. Find someone who can know you and see you and support you and lift you up when things are not going well. And to keep asking the question, why am I here? What am I doing here? Is this making me happy? And if it's not, then find out why and can you change it? But I think having a best friend or a true mentor is a key, and I was lucky enough to have that with a best friend that I worked with for several years. And, we go out and have a glass of wine or a beer after work, and that's not, hospital conversation is not generally happy hour conversation unless you're sitting with a group of nurses. So that kind of support I think is key. And being able to say, I don't know, I need help. And when I learned that lesson, even as soon back as 5 or 6 years, to say, going back to technology, I can't do this. This is so stressful for me. And someone stepped in and said, let's find another way to get it done. So being able to be honest and say, you never know who's out there to hear it, to say, how can we do this so that everybody wins? The job gets done, but my mental health is not suffering because of it.
Very, very true. Diane, thank you for sharing your insights. Your perspective reminds us that nursing is evolving and we all have a role in shaping its future. To our listeners, what do you think about the current state of nursing? Share your thoughts with us on Facebook or Instagram at Why We Nurse or email at whywenursepodcast.com. Until next time, stay strong, stay compassionate, and remember why you nurse.